Hello, today we're going to talk about a balanced conceptualization of mental health and behavior, where we can appreciate both positive and negative aspects of our behavior in a more holistic sort of way. As we have already considered, in the 20th century, much of the focus, especially in the area of clinical psychology, was on what is wrong with us. And it wasn't until towards the end of the 20th century and the development of positive psychology as a field within psychology that a more concerted effort was made to do research in exploring what is right with us. And we've been considering various aspects of that approach throughout our entire course. But there were some people in the 20th century who were interested in looking at what's right with us. We've already considered how developmental psychology as a field within psychology has, from its beginning, really been interested in looking at how we change over our entire lifespan and how we can use that information to help us to experience greater what developmentalists call optimization, that is to live the best lives possible. And we've looked at some interesting longitudinal studies that have shed light on how we can live lives more fully that have more meaning and purpose. In our reading for this topic that we're discussing today, you have the opportunity to look at some other earlier writers, including Marie Jahoda, who focused more on what in her day was called mental health and characteristics of good mental health. The humanistic field of psychology, which came a little bit later, also has had a lot to say about how we can live lives more fully, lives in which we can more fully realize our potential and experience a greater sense of meaning and purpose in our lives. So, in our readings for today, we have the opportunity to consider some of the reasons why there has been such a fascination with studying the abnormal and why it's taken a while for studying what's right with us to catch on. Abnormal behavior is fascinating to learn about, and the suffering that people experience when they struggle with psychological disorders is considerable. And we have compassion for people who are struggling and going through that kind of pain. So developing a better understanding of disorders and how to treat them is, of course, important. The view of the treatment of mental illness has been viewed as more of an active process, whereas the attainment of mental health, well-being, a more modern term that we might use for that, has been viewed as a more passive process. And for the longest time, received much less attention, as we've already commented on. So now, we're able to take a more balanced view, looking at strengths as well as weaknesses, what's wrong with us, as well as what is right with us. And through this process, it's helping us to develop a more complete understanding of our human nature. Two of the challenges that have threatened this balance include something that we've already talked about, our tendency to commit the fundamental attribution error in the way we understand the behavior of others, and also what is referred to as a fundamental negative bias. Do you remember what the fundamental attribution error involves? Yes, it involves our tendency to attribute the negative behavior of other people to internal personal factors rather than situational environmental factors. That is the fundamental attribution error. The fundamental negative bias involves our tendency to judge, evaluate the behavior of others more so when certain conditions are met. And these conditions include what's called saliency, value, and context. Saliency has to do with whether or not a behavior stands out. Value has to do with whether the behavior is positive or negative. And context has to do with whether the behavior occurs in a vague context or a well-defined kind of context. So when a behavior is more noticeable, when it stands out, when the value we would place on that behavior, the way we would judge that behavior or assess it is that's a negative behavior, that's an abnormal behavior. And when that behavior occurs in a vague context, we're more likely to judge that behavior and the person showing that behavior in a negative, critical way, instead of being able to appreciate more how other factors might influence what's going on with that person, especially situational factors. So one individual who's come up with a way of helping us understand our human nature in a more complete kind of way is Beatrice Wright, who came up with what she calls her four-front approach. And her four-front approach basically helps us to really ask four questions to get a better understanding of what's going on within the person and also in the person's life, where we look at both strengths and weaknesses. So one of the questions we ask ourselves is, what are the deficiencies or lacks within the person? Another, what are the strengths of the person? Third question is, what are the destructive forces in the environment? And the fourth question is, what are the resources in the environment? This can be an especially helpful approach to take in a counseling situation where we are trying to help clients to gain a better understanding not only of their problems and concerns, but also of their strengths and resources, so they can build on those strengths and resources in helping themselves get to a better place. Another area that could be emphasized more to help us take a more balanced approach to understanding mental health and behavior is thinking about people in developmental context. That is, where is a person in their developmental journey? What are the important developmental issues that they're dealing with at this point in time? To use a clinical example, let's say that you become a mental health counselor and you're working for an agency that does assessments in an emergency room of people who are suicidal or have other mental health issues. The kind of developmental issues that a 14-year-old girl is probably dealing with are going to be pretty different than the developmental issues of, say, a 45-year-old woman, both of whom may be depressed and suicidal. So understanding their current concerns in the context of where they are developmentally can help a clinician to have a more complete understanding of that person and how they might be able to help them. Another factor that needs to be considered in developing a more balanced approach to our understanding of behavior is culture. And we've already talked about culture and the importance of looking at people in a more culturally embedded kind of way, where we appreciate how culture influences who they are, what their values are, what's important to them, the struggles that they might be having, to understand them in a cultural context, as well as how strengths are viewed in different cultures. So in our reading, we learn about what's called culture-bound syndromes. And as you may already be aware, culture-bound syndrome is one that tends to occur more in some cultures than others. Syndromes here, we're talking about actual psychological disorders that people may experience. An example of this that we talked about earlier would be how social anxiety disorder manifests itself differently in Western versus Eastern cultures. If you recall, if somebody has social anxiety disorder in Western culture, they're very concerned. They might appear foolish in front of other people when the attention is focused on them, say giving a speech. Whereas in Eastern culture, the concern is more that the individual might offend another person. So when we are in clinical situations, or really any situation that involves relating to other people in a professional kind of way, whether it's in the criminal justice field or the human services field, whether it's in the role of a professional counselor or other professional helping person, it's always important that we can try to understand the person that we're talking with in a cultural context, to understand where they are coming from based on their cultural experiences. And for us to have an understanding of our own culture and how it might influence how we would look at other people, and possible blind spots or biases that we might have that could interfere with our effectiveness and our ability to help others. So thinking about this topic in a clinical context, one of the things that we have the chance to learn about in our readings and to hopefully reflect on is the diagnostic process that's used in mental health settings. As we've already discussed, the Diagnostic and Statistical Manual of Mental Disorders, the DSM, is what is used in this country in order to diagnose psychological disorders. And the DSM uses a categorical approach to diagnosis. In other words, you determine if people meet the criteria for a particular diagnosis before making that diagnosis. Well, one of the things that we learn about in our reading is that there is overlap between those diagnoses and some concerns about the reliability and validity of some of them, or some than others, although each new edition of the DSM is better than the one before it. And some people are now suggesting moving more towards a dimensional approach to diagnosis, where you look at where people are on different dimensions of behavior in terms of levels of severity, rather than trying to place it into specific categories. And in fact, as we speak, some researchers are looking into how the dimensional approach might add to the already used categorical approach in diagnosis and in DSM-5. There is some incorporation of dimensional diagnosis in that document that came out, I believe, in 2013. There's very little, if any, attention given to looking at people in a developmental context or adequately considering cultural factors in the way DSM diagnosis is made today. Hopefully that can improve in the future. I would like to talk with you about one particular approach to working with clients that is discussed in our chapter, that incorporates some of the ideas that we've been talking about today, and that is the developmental counseling and therapy approach of the IVEYs, I-V-E-Y. Their approach looks at how pathological behaviors can be a logical response to life events. And when we understand the context in which a person's symptoms have developed, it can help us to appreciate how those symptoms may be a logical response to what's going on in the person's life. And the IVEYs also try to view each person as a whole, looking at their strengths and weaknesses in balance, and looking at what's going on in their life in a developmental context. I'm glad you will have the opportunity to learn about the IVEYs in your reading for this particular lesson, and that you'll have a chance to really reflect on their thinking and the approach that they take with clients. So, as we move forward in trying to get a more balanced understanding of ourselves and how we work with individuals in professional roles, we learn of some things in this chapter that can be especially helpful. We can take the forefront approach in looking at both strengths and weaknesses within the person and in their environment. We can think about people in developmental context. We can appreciate the importance of culture in influencing how we are. And we can think not only about dimensional ways of looking at people, we can also think about categorical ways and appreciate that the dimensional approach can add a better understanding of what's going on with people than just focusing on categories, which has tended to be the approach of the DSM historically, and even to a certain extent today. So we're not saying we should throw out the categorical way of understanding people, just looking at them, not just categorically talking about psychological disorders now, but also looking at them in a more dimensional kind of way, which helps us to realize that behavior is on a continuum from normal to what may be considered abnormal. And it's not so much we can say that this is normal and that's abnormal in all cases, but it's a matter of degree when we look at things in a dimensional kind of way. And also thinking about culture and context in deciding how we're going to understand behavior. And then finally, the way we communicate that understanding to clients is extremely important so that we can go about it in a way that can be uplifting, in a way that's not judgmental, in a way that helps people to look at their strengths as well as their limitations, in a way that doesn't rely so heavily on labels, but focuses more on potential. Taking that approach, I believe, has a greater likelihood of helping people to get to a better place, where hopefully eventually they may be able to move above zero and experience flourishing in their lives. Thank you.